Hello everyone, good evening. I am Dr. Bawadekar. Welcome to my channel Dr. Bawadekar's Homeopathy. Today we are going to talk on a subject called as uterine fibroids. It is very common topic and which is commonly seen in females, and most of the females get fearful, so I am trying to simplify this topic today. Before going to the topic, I will just explain everyone that how is our uterus and what are fibroids. Okay, I'll just show you a small diagram, kindly view it. This is a uterus which is located in the lower abdomen of females below the umbilicus. It is as a size of this much, the front side. It's very small that way. Now this organ consists of main uterus. It has got two tubes on left and right side. Also it has got like ovaries where the ovulation takes place and the ovum passes to the tubes and the pregnancy appears over here. This is the uterus. This above part is called as fundus. This is the side of uterus. This is the inner wall which is called as endometrium. This is called as the muscle mass called as myometrium, and this is the lower part which is called as a cervical region. These are the few things which we should know in the organ of uterus. Fibroids are the tumors which grow in this uterus. Some grow here, some go inside, some grow here, some grow lower side. There are many types. Okay, so I will just show you that this is the abnormal uterus where the fibroids has grown. Fibroids means muscular tumors. If it occurs above this thing, it is called as fundal fibroid. If it occurs below, it is called as pedunculated, just suspending in the uterine cavity. If it is in the myometrial mass, it is called as intramural fibroid. If it is inside the uterine cavity and inside the mass, it is called as subserosal fibroid. These are all medical terms. Okay. Now, if it is outside the side, this submucosal fibroid. Subserosal, they bleed more because the endometrium is quite rich over here, and every time the menses when occur, the layers and the changes that take place over here. So these are the tumors areas which they are grown. They can grow anywhere, but these are the common areas in the uterus. Okay. This picture was to just show you the idea about the fibroids. Now, what are fibroids? I'll go into very short time. These are non-cancerous growths in the uterus. It is assumed to be, and they appear during the childbearing age. They are in medical terms also called as leiomyomas or myomas. These are the common terms used for fibroids. Now, these fibroids are basically nothing but muscular tumors which occur inside the organs, and they trouble the females very much. Why should every female or patient should know about fibroid? Because 20 to 80% of the females, they suffer from fibroids in our countries at the age of from the age of 30 years to 50 years. So this problem is very common. They have many problems in their life because of the fibroid. Hence, we should know this topic in short. How is that fibroid diagnosed? Usually, for abnormal complaints, when a female goes to a doctor, they advise some investigations. From sonography or from MRIs, you can diagnose the tumors called as fibroids. Now, what are the risk factors which are involved in developing these fibroids? See, age is also a risk factor. 30 to 40 years of age, lots of hormone changes go on. Premenopausal age, hormone changes go on. So this is a risk factor. Family history. If the mother has got a tendency of fibroid, the daughter may inherit the tendency. Ethnic origin. African women are supposed to be likely to develop more than a white woman. It is shown in a statistical study. Obesity. Those who have tendency to become fat and obese usually develop fibroid tumors in their uterus. Eating habits. Eating lots of red meat, ham, then they have higher risk of eating less water. They have a high risk of developing the fibroids. What are the symptoms of fibroid one should suspect in normal menstruation period when it gets disturbed? I will tell you some few symptoms which female should observe. They feel heaviness in the abdomen and sometimes they have very painful menses. Then always there is a fullness in the pelvic area. Pelvic area means the below area, which is below the stomach. During the menses they feel very heavy. Sometimes their lower abdomen below the umbilicus feel large and enlarged than normal. Slowly every month it starts feeling big because of the tumor. Also they have low backache. Many times with the menses it is a worsen. Sometimes they may also have without menses backache is there. So these are the common symptoms. Now what causes fibroids? Exact cause is not known for doctors and scientists also, but it is assumed and also partly proved that estrogen and progesterone level disturbances can cause fibroids in the females. Now, many patients feel that will this fibroid turn into a cancer? Friends, these are muscular tumors, so it is very, very rare. 1 in 1000 will turn into a cancer, and the may that also, and which is called as leiomyosarcoma. That is a medical word used for is having fibroid does not mean that there is a risk of developing cancer of the fibroid. Because of fibroids now in pregnancy, pregnant woman, they feel that if I become pregnant, now what will happen if there is a fibroid? There are some chances of cesarean section. There are chances that the labor or the delivery process may become delayed. There may be a placenta rupture. There may be complications arising during like preterm delivery. Before 9 months, the patient may deliver because of fibroids, and many more. Now, things I will suggest you which will be helpful to you now. Which are the best foods for fibroid? Because medicines and other care of this is given by doctors, but food hardly anyone advises. So I would like to advise you best foods to eat with fibroid. They are organic foods, high fiber foods including cruciferous veggies like broccolis, green leafy vegetables, beta carotenes which are rich, such as carrots and sweet potatoes are rich in beta carotenes, high protein and iron such as legumes, flax seeds, whole grains, and citrus fruits like oranges, apples, also like lemons. These are very helpful. Now, what should we avoid if a female suffers from fibroid tumor? In diet, they should avoid red meat. If they are non-vegetarian eaters, then high fat, processed meats, highly processed foods, added all artificial sugars of all types, excessive sodium or salt, soda and sugar drinks, also excessive of calories they should avoid. This is very important because it helps in improving the fibroids if you carry these things along with the medications. Now, what shrinks the fibroid? This also question comes in mind of many females. See, I'll tell you, milk and dairy products may help to reduce the fibroids. Dairy products contain a high amount of calcium, magnesium and phosphorus. These nutrients may help to prevent the growth of fibroids, and these may reduce. But it is observed that naturally after menopause, the fibroids, if already are there, they get reduced after a female undergoes a menopause process. Now, patients ask me, can lemon drink is useful for fibroid patients? Yes, it is rich in vitamin C as well as vitamin 6. So it helps in balancing the female hormones. Hence, it has got an antioxidant property also. So it will be definitely helpful in reducing the fibroids. Can exercise cure the fibroids? This is also a common question which we usually face. Friends, no, there is no cure with exercise for fibroids. But healthy lifestyle will keep your all body healthy, and it will prevent the developments of fibroids by reducing your weight if you are becoming obese. Now, if exercise is good, which exercise to do? This is a common question. So I'll tell you, it is very easy for us. We advise Kegel exercises, K-E-G-E-L, Kegel exercises. These exercises, they strengthen the pelvic floor muscles which support the uterus, the bladder, small intestines and the rectum. So these exercises are quite helpful. Jogging and swimming may reduce the weight and will be helpful to you. Some people ask me, sir, how can I reduce my fibroids very fast? Because I am very scared of it. For them, I'll have 2-3 words for them. Now follow a Mediterranean diet. Add plenty of fresh cooked green vegetables, fresh fruits, legumes. If you are having a fish, have it every day. Cut back alcohol. Balance your estrogen. Lower your blood pressure if you are having at menopausal age, and have enough amount of vitamin D. This will help you to reduce the fibroids very fast. Of course, to balance the hormone levels, meditation is one of the good part, which if you believe, you can surely practice. Now the questions comes, how are fibroid treated? Now, all the fibroid treatments, it depends on where the fibroid is. Just like I told you, it depends upon like in which region it is in the uterus. If it is here, it is submucosal, it is going to bleed a lot. If it is in the fundal, it may also bleed a lot. Now, fibroids are to be treated up to the size of 4 to 6 centimeters average, but it is not a rule. Above that usually are surgical cases, but some patients respond very well to homeopathic medicines and we get good results. So the fibroids, it depends on the size, their locations, which age group the patient is. If the patient is at menopausal age, After menopause they get shrinked on their own. If they are less than menopause between 30 to 50 years, it all depends on the doctor who is treating the fibroids. So the fibroid treatment will be decided by the doctor. Patient should not worry about it. Now they should follow the diet and regular exercises. Suppose if all the medical treatments fail, no pathy medicines act, then surgery comes in place. So there are surgical options or other options also. Suppose there is a fibroid in a young female who is undergoing to go pregnancy and the tumor is quite big. Only the fibroid tumor can be removed, that is called as myomectomy. So this helps, but there is no guarantee that it will not recur again. It may recur again. Cases are being seen like that. Then if a patient is at menopausal age, then probably due to bleeding complications, anemia and heavy bleeding, she may be advised hysterectomy, that is surgical removal of the uterus. Myolysis is also one of the treatment where the needle is inserted inside directly the tumor and the tumor is freezed, you can say. There are many surgical procedures. Uterine fibroid immobilization, I will not go in detail. Then they go through a catheter and they reach the fibroid and they destroy it. We will best talk about the homeopathic medicines. See, treatable fibroids are to be decided by a homeopath. So never self-medicate. Ask your homeopath to basically decide whether it is treatable. Now, homeopathy has got no side effects. Treatments are assured. They last permanent. Our medicines which are based on pathological prescriptions definitely reduce the hemorrhages, the pains, the discomforts, and the constitutional medicines which we prescribe can also prevent further development of new fibroids, as well as they can reduce down the size of fibroids. So this treatment I usually advocate to all of my patients. I will not be going in the detail of homeopathic treatment. Few useful remedies which we use, that I will be just explaining you. If the symptoms match with this remedy, 100% results are expected for fibroid patients. First remedy is like aurum muratum nitronatum. If the patient has ailments from anger and vexation, if they feel dullness, sluggishness and difficulty in comprehending, and all the complaints of during the periods, if they are better in the evening, we can think of this remedy. Calcarea carbonicum, which is seen in, like our book say, fair, fat and flabby females who are in 40 years of age, who are chilly patients, sweat a lot, constipated. If the patient is in this age group, Calcarea carb is one of the good remedies. Thyroidinum is a sarcode which is also used as an intercurrent if fibroids are associated with hypo or hyperthyroidism. Mainly females suffer from hypothyroidism because of the overweight and obesity. Uracil is one of the good remedies where we see that if the periods come after 2-3 months and there is a yellow leukorrhea with fibroids. Sepia is also a constitutional remedy where you see sadness in the female. Some females have indifference to the family. The close family members, they become indifferent to them. They quarrel a lot, irregular menses, they have prolapse of uterus filling. You can think of this sepia. Laches is also one of the good remedies where there is a bleeding after menopause. Discharges are blackish, pain before the menses, and which reduce down after occurrence of menses. If this is there, laches works wonderfully. Thalassi bursa is one of the key remedy which we used for metrorrhagia with violent uterine colics, too frequent and copious menses seen in nervous and restless patients, which drive them from place to place. Also, such patients they weep causeless, they are in tearful mood, and they have disgust for everything. There are many remedies, they all depend upon the individualization. So friends, your remedies will basically be decided by your homeopaths. So like I'll conclude my talk, which should not become too long. Fibroids are really treatable with homeopathy. So take advice of your homeopath. If no one is available to you, you can definitely contact me on my WhatsApp number. I will be happy to guide to you. So stay happy and forget all the worries about the fibroids. Thanks for a patient hearing.